Doing today?
I'm fine.
Good. So what we're going to be doing is cranial nerve screening, and what this means is I'm going to be testing some pupil responses in your eyes, as well as eye movement, sensation in your face, and along with that I'll be testing some muscles in your face and your shoulders, okay?
Okay.
Alright. So for the first one, we're going to test cranial nerve number 3. And for this one, if you don't mind just looking straight forward at me, I'm going to have this light shining in your eye, and my hands are going to be right here. So just keep looking forward. Good. Alright, and both of her eyes, pupils constricted with that, which is normal. If you'll follow my finger. Good. And her eyes did track immediately with that, and the pupils constricted, which is also normal. The next one is going to be a combination of cranial nerves, so it's going to be cranial nerves 3, 4, and 6. This is going to test eye movement, so if you don't mind just following my finger. Good. And do you have any double vision with that? Alright, so abnormal response is if she did have any double vision, or her eyes were unable to track my finger, but everything was normal. Okay, for this next one, we're going to test cranial nerve number 5. And if you don't mind holding your hand out, I'm just going to be testing for sensation in your face. So you're just basically going to feel a little tickle like that. And your eyes are going to be closed, so just let me know when you feel it, okay?
Okay. 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 Okay.
Good. Alright, and then to go along with that, we're going to do a sharp and dull test. So if you hold your hand out again, this is going to be sharp, and this is going to be dull, okay?
Okay.
Alright, if you don't mind closing your eyes again.
Dull.
Good.
Sharp.
Good.
Sharp.
Good.
Dull. Dull. Sharp.
Okay. Good, and everything was normal. She felt each one of those. The other part of cranial nerve number 5 is going to be some muscle movement. So can you open your mouth for me? Good. Clench your teeth. Alright, I'm going to feel some muscles right here. Relax. Clench your teeth again. Good. And one more time. Good. Okay, can you move your jaw side to side? Good. Okay, so any abnormal responses to that would have been if her jaw were to deviate to one side, or it was unable, any of those muscles were unable to contract, but that was normal. Okay, so the next one we're going to do is cranial nerve 7, and this one's going to be responsible for a lot of your facial expressions. So for this, if you don't mind, can you raise your eyebrows for me? Good. Alright, can you close your eyes tight? Don't let me open them. Good. Open them. Can you smile for me? Good. And then can you puff your cheeks out? Good. Alright. And any abnormal responses for that one would have been if she had any facial drooping or asymmetries between both sides of her face, but that was normal. And any inability to close her eyes as well. Okay, moving on to cranial nerve 8. This one's responsible for hearing. So, can you let me know, can you hear this?
Yes.
Alright, so for this one, if you'll close your eyes and let me know when you don't hear it anymore.
Okay.
Okay, keep them closed. I'm going to do the other side.
Okay.
Good. That was also normal. An abnormal response would be if she didn't hear anything, or if there was a significant difference between both sides, and everything was good though. The next one we're going to do is cranial nerve 11. So if you don't mind, can you shrug your shoulders? Good. And can you look side to side for me? Alright, I'm just going to go in and try to resist some of those. So try shrugging your shoulders again. Good. Okay, can you turn to this side for me? Good. side. Good job. Alright, and again, abnormal response would just be the inability to do those motions, but that was good. The last one we're going to do here is cranial nerve 12. So if you don't mind, can you stick your tongue out for me? Good. And can you move it side to side? Good. So abnormal response for this would have been the tongue deviating to one side or the other when she stuck it out, or the inability for her to move her tongue side to side. But all that was normal. Do you have any questions for me?
No.
All right, well, good job. Thank you very much.
Thank you.